I want you to imagine that you're blowing up a balloon. And all you want is a big, plump, glorious balloon to show off to all of your friends. However, unfortunately, there's something not working quite right in the little blowy bit of the balloon. So the air from your lungs just isn't flowing through that little pipe and your balloon remains small. Growing a developing baby, or fetus, is a little bit like blowing up a balloon. Mum pumps blood throughout her body and into a series of pipes, or blood vessels, that flow into the fetus, with blood that's rich in oxygen and nutrients to help the baby grow big and strong. In most women, these pipes are healthy and functioning to support a growing baby to its ideal size. However, sometimes these pipes are damaged and, just like your balloon, don't work quite right. When this blood doesn't flow the way that it should, the baby, just like your balloon, remains small. In Australia, 1 in 10 babies are born small, and these babies are at an increased risk of worse outcomes, both in the short term, such as seizures and other brain injury after birth, and all the way through to adulthood, with an increased risk of diabetes and heart attacks. Currently, there isn't much that we can do for small babies during pregnancy to help them grow. So, what can we do? In my thesis, I'm using a massive, rich, integrated dataset from the Mater Mothers Hospital, which describes the pregnancies, labours and post-labour experiences of women who birthed at the Mater and their babies. Using that information, I'm comparing the group of babies that were born small to the group of babies that were born full size, to identify a series of maternal and pregnancy factors that might put a woman at risk of having a small baby. I'm also investigating the risk of severe brain injury in small babies after birth, which requires early diagnosis to possibly reduce some devastating consequences. Why? Because we want to improve the way that we identify women who are at risk of having a small baby, to then deliver the appropriate care and intervention to those high-risk women whose babies may benefit from it, and to better identify and manage severe brain injury in the babies. Do you remember trying to blow up that balloon that you really wanted to show off to all of your friends? Can you imagine if that was your miraculous, treasured little baby? I want small babies and their mums to have the best chance at the best life. I hope that my thesis will improve the way that we identify and support these babies, so that one day they can grow up big and strong and blow up a balloon of their own.